Now the lower leg is made up of two bones, the tibia and the fibula. This is a lower leg bone from your right leg. Now one way to easily remember the arrangement of the bones is that from the outside to the inside, or from lateral to medial, the bones go in alphabetical order. So this would be lateral, F before T, fibula, tibia. Now as the bones are sitting here, several notable features that you would notice just from feeling the surface of your skin. At the end, this would be where your foot would contact. You have two big bumps. This bump right here is the medial malleus. If you feel the inside of your ankle, that bump that makes up the inside of your ankle is this bone part right here. The outside of your ankle, the big bump on the outside of your ankle, is the lateral malleus. So the medial malleus is actually part of the tibia. The lateral malleus is part of the fibula. Now another feature that you can easily palpate or feel from the outside of your skin is this very sharp margin that runs right around the front of the tibia. This is what we all commonly call the shin. Hence the whole bone is usually called the shin bone. You can easily palpate this one, but also if you look very closely at the proximal end, you're going to get this bump right here. That bump is called the tibial tuberosity. This is the point where the patellar ligament attaches right here. This is where the force is applied to lift your lower leg. So you do a leg extension, like stepping out to walk or to run, the patellar ligament pulls out of the bone right here. And many times that bump can be aggravated from lots of running and jumping. And we generally call that that condition, where you get a large painful spur there, Osgood-Schlatters disease. And for some people it can be very, very painful. Holding the tibia to the fibula are many ligaments. Now I'm not going to test you on all the ligaments that hold them together except for one. There is one you need to know. There is a membrane or a ligament that binds all along this middle surface here. This membrane is called the interosseous membrane, and it helps to bind these two bones together. This is the kneecap or patella. The kneecap is a sesamoid bone, which means that it is a bone that forms in the middle of a ligament or a tendon. Now that would seem kind of impractical, but really it's pretty helpful. If a bone forms in the middle of the tendon or a ligament like this one does, it's going to prevent wear and tear of that tendon against the bone. If you were to think about having a ligament running from the thigh bone to the shin bone or tibia, those ligaments are going to be rubbing across two bone surfaces. Even if the bone surfaces are covered with articular cartilage, it still can produce wear and tear. Bones develop inside of some of these, like the kneecap, and it prevents the wear and tear on that ligament.